Siku hiyo usiku sikulala. Na kisa na maana ni kwamba nilijaribu kila ninapohisi kwenda haja ndogo, nikifika chooni haitoki. Kulala ikawa ni kibarua.
Prostate cancer is the leading cancer affecting men in Kenya. Over 3,500 men in Kenya die annually from this deadly disease. This is according to the Global Cancer Statistics of 2022. Now, being of African race, having a family history of prostate cancer, and increasing age are just some of the risk factors that have been identified. There are no particular early symptoms, and this means that over 75% of Kenyans will present in advanced stages of the disease. At this point, symptoms may include lower back pain, lower limb swelling, blood in semen or urine. It's, however, important to note that urinary symptoms do not always equal prostate cancer. Now, to make a diagnosis, a detailed history, thorough physical examination are normally required. This will then be followed by investigations such as the prostate-specific antigen levels, biopsies, and imaging. We then stage the disease from stage 1 to stage 4. But in order to understand or for ease of treatment, we classify this into localized disease, locally advanced, and metastatic disease. Treatment will then depend on the stage and also the general well-being of the patient. Now, treatment options will include surgery, radiotherapy or brachytherapy, hormonal treatments, chemotherapy. While doing this, there is active surveillance of the patient, because if this disease is left untreated, it can spread to other organs and lead to death. Asanteni sana kwa kuungana nasi. This is ULIZA Daktari and I am your host, Dr. Lauren Mengesa. Mimi ni daktari wa kina mama, lakini leo tunaangazia wanaume. Our case study today anaitwa Willis. Let's listen to his story.
Hivi leo nimekuja kuzungumza kuhusu prostate cancer. Mimi nikiwa mmoja wao. Mnamo tarehe 25 mwezi wa 3 mwaka uliopita, nilikuwa kwenye safari na nikawa tumekutana na jamaa zangu pale Naivasha. Lakini siku hiyo nilishangaa sana. Bia ya kwanza ilibidi niende haja ndogo mara 3. Bia ya pili ilibidi tena kila nikinywa naenda msalani karibu mara 5. I had a record stop of 15 different times on the road trying to force urine. But each time I tried, only a small drop came out. So that day and night is when I really started experiencing troubles. I kept on going to the loo, but the urine wasn't much, it was just a little bit. Nikafikiri huenda ikawa labda bia ambayo nilikuwa nimekunywa siku hiyo haikuwa nzuri. I did not sleep. That was the longest night I've ever come across. I was alone in the it's a tent, and it reached a point where I could not even urinate at all. So my bladder was really full. I made desperate calls to several doctor friends. Mida ya saa 10 asubuhi, mmoja akanipigia, and he really got worried. He told me, I think you're in trouble. So I told him, what do you mean I'm in trouble? You have an emergency? You have urine about 1.5 or maybe 2 liters, and you need to get it out. Wewe utakachofanya ni asubuhi, fanya juhudi, nenda kwenye town iliyo karibu nawe, waeleza wakuwekea kile kinachoitwa catheter. So they inserted it, and indeed, when the urine passed out, I felt like I was back on earth. So when I came, I went for tests, and what really worried him was my PSA. My PSA is usually meant to be 0 point, was as high as 380. Test nilizofanya zilikuwa mingi. Ya mwisho nilifanya ya PET scan. Hiyo ndio ilipata kauli maalum kwamba ninayo saratani.
Naam, tupo site na wanaume jongeni. Leo daktari wenu yuko hapa. Today joining me is Dr. Patrick Muigai. He is a consultant urologist based in the county of Taita Taveta, and he also sees patients in private practice at Upper Hill, Nairobi. Karibu sana, Dr. Muigai.
Thank you, Dr. Lorraine.
Now, nimeulizwa na a patient recently. Ameniambia, daktari, kuna gynecologist wa wanaume. So I would like to ask, what is the equivalent of a gynecologist for men?
And number one, there is no equivalent of a gynecologist in men because gynecologists are only supposed to see the reproductive system of the women, right? So a urologist in a nutshell is not the male equivalent of a gynecologist because a urologist usually sees both men and women. It's not a doctor for women only. A gynecologist is a surgeon. A urologist is a surgeon. Let's start from there. A urologist is a medical doctor, is a surgeon, but he's a doctor who deals with the urinary system only. So from the kidney down to the ureters, to the prostate, to the bladder, to the testicles, to the penis, to the urethra, all those. And both men and women, they have bladder, they have kidney, they have urethra, even children. So we see all of them. So we are not the gynecologist equivalent for men. Yes.
Sasa leo tunaangazia prostate. We want to listen to the men. And before tuanze, tunataka kuelewa hii prostate ni nini, iko wapi, na kazi yake haswa ni nini?
So the prostate inaitwa tezi dume kwa Kiswahili. Ni kiungo. It's an organ that is found just below the bladder, right? So as the urine, and before we go on, let me just say, only men have prostate.
Only men, okay.
Women do not have prostate, right? Because men usually come to the office and ask me, and daktari, hii prostate cancer, is it sexually transmitted? No, women do not have prostate. Okay? It's only in men only. It's an organ that is found just below the bladder in men. Now, its role is that it produces part of the semen, all right, that helps to nourish the sperms so that they are energized, they are ready for fertilization. So that's the work of the prostate. We don't know the prostate much because of what it does in the body. We actually know the prostate a lot because of the problems that are associated with the prostate, and there are many. For young men especially, they can get an infection, something called prostatitis. The commonest problem that affects the prostate is something called benign prostate enlargement. That means it is becoming enlarged, it is blocking urine, and it is not cancerous. So we call it benign prostate enlargement. But then there's usually the elephant in the room is the cancer, which is the commonest cancer that is affecting men in Kenya today. So that's the prostate in a nutshell.
So mmesikia sasa tumejua prostate iko wapi na tungependa kwanza kuwasikiza. As we told you, this is your show na leo tunataka kuzungumza na nyinyi. Please talk to us. Our SMS line is 22422. Our socials are on ULIZA, Daktari, Citizen. So please engage us, send us your questions. We want to hear from you. We want to respond to you today. So kuna zile symptoms ambazo zimeguziwa za prostate cancer. What are the common things that wagonjwa huwa wanakuja nazo? What are the common signs and symptoms?
So the thing about prostate cancer is that, number one, it does not have early symptoms. So it is not likely that you are going to say this gentleman has early prostate cancer unless they do screening. That's the sad part. And because of that, studies that have been done locally have shown that 75% of patients who come to the hospital present late at stage 3, at stage 4, when cure is impossible. When you're at stage 4, we say we can palliate. All right? So that's the bad problem about it. How does it present? So prostate cancer, usually for the guys who present late, the many men I see in my office every day, typically it is a back pain. Okay? They will come with a back pain and they will tell you this pain has been progressively worsening over time. Most people have even gone to physiotherapists. They have had physio started, but the pain is worsening. That's the commonest symptom that they present with. However, for those guys who usually pick early, they come to the hospital because of urinary symptoms, right? Like the gentleman, like Willis.
Exactly.
See, Willis presented with urine retention and something called urgency and frequency. Okay, those symptoms are not very specific for prostate cancer, but they are specific for urinary obstruction, or what we call bladder outlet obstruction. So most people will come to the hospital because of those. They will come because their urine stream is weak, because they are having urgency, or they have to go to the toilet many times. They cannot hold urine, or they feel they have incompletely emptied their bladder. That is what will bring them. But those symptoms, like I've said, they are not specific. But then when they come to the hospital, part of investigation, we do a PSA, and we see it is elevated. So that's how we end up diagnosing prostate cancer. For the advanced disease, apart from the low back pain, these people will come with urine retention. They will come with blood in urine, something called hematuria. Some will come and tell you, Daktari, when I ejaculate, there is blood in semen, right? Others will come with swelling of the legs, okay? Either one leg or both. Okay, it can be one leg because of something called edema, okay, or lymphedema. It can be both legs because either the kidneys have failed and both legs are swelling. Some will come because they feel they cannot walk for long. They are getting fatigued easily because either the disease has gone to the lungs or it has gone to the bones, and the production of red blood cells has reduced. So they have something called anemia. Their blood levels has gone low, and typically those are signs of an advanced disease. So that is a presentation, general presentation of prostate cancer for most men that we see. Yes.
Na tukiangazia risk factors, kuna wale wanaume wamekuwa wakisema, kama mwanaume hana wanawake wa kutosha ama hali ya kujamiana haifiki kule ambapo inafaa. Is that one of the risk factors? Is that something true? Ama ni mambo ambayo tunajiambia tu? What are the real?
So the known risk factors for prostate cancer, number one is age. All of us, as we age, the risk increases. The median age for diagnosing prostate cancer in Kenya is 66 years. So as we age, the risk increases. But I will tell you, we have increasingly been seeing younger men being diagnosed with prostate cancer in their 50s or even in late 40s. I think I've seen 2 men who have been diagnosed with prostate cancer at 48, I think, and 49. And we are seeing them in 50s. But the median age is 66. So that is one of the risk factors. The other risk factor is family history. So if your father, your brothers had prostate cancer, the chances are that you also will get prostate cancer. So this is a demographic of people that we tell them they need to be screened much, much earlier. So family history. Then there's African risk, all of us. If you are a black African, then the risk is higher than your Caucasian counterpart, right? And also what has been shown is that the biology of the prostate cancer in African men tend to be more aggressive than for our Caucasian or the white counterparts. Of course, the other thing is something called genetics, okay? So some people, their DNA is built in a way that they are inherently more at risk of getting prostate cancer than other people, right? So age, family history, African race. Those are the main risk factors for getting prostate cancer, right? So it has nothing to do with the frequency of sexual intercourse. Yes.
Asante. Sasa ni daktari, ni kama umeona maswali ambayo nimepokea. Birgen Tito was asking the same question tumeuliza, ambapo if a man takes too long before having sex, if that is a risk factor. Na pia kulikuwa na swali nyingine kuhusu the black race. So I think we've addressed that. Now we're going to take a short break, and after the break we're going to be taking in your calls. So tafadhali reach us on our call line, which is down below, or SMS us on 22422. We'll be back shortly tukiendelea kuzungumza maneno ya prostate cancer.
Kansa imefanya mpaka maboma yao tuishe, kwa sababu mpaka prostate cancer imekuja imeharibu doa. Watu hawajui kansa inakuja namna gani. Unajikuta uko na ugonjwa ikiwa stage 3 na stage 4.
Prostate cancer is the cancer that attacks the prostate gland in male, it results into an abnormal enlargement of the prostate gland that ends up causing swelling, which affects the neighboring organs and tissues around the gland and exerts pain.
Nimeshawahi sikia juu ya prostate cancer, lakini sijawahi enda kupimwa ama kukaribia pahali iko matibabu ya kupima hiyo prostate cancer.
I've just overheard it. It kills, it affects men. Mostly I don't know what causes prostate cancer.
Hata mimi huwa naisikia, lakini ni ile huwa tunasikia mambo na inauza mambo na ni saratani ya kizazi.
All men in the society, whether in rural or urban areas, they should take the urge to go to the hospital and do the checkups more frequently to avoid the disease from succumbing from their lives.
Naam, tunaangazia saratani ya tezi dume, na kama mlivyosikia kutoka wale tumezungumza nao, wanasema saratani hii, Genesis anatuambia, inavunja ndoa. Na hapa kwenye SMS tuna swali ambayo tunaulizwa, can someone erect when having prostate cancer? Je, inazuia mambo ya kujamiana?
Right, erection inaitwa kujamiana.
Kujamiana ni kitendo.
Okay. Sawa. So prostate cancer depends. When you have prostate cancer and has not been treated, you will not be having erectile. It will not be causing erectile dysfunction, right? See, erectile dysfunction is a different topic, whole big topic, right? Most people who get who get prostate cancer are probably in their 6th decade. They're in their 60s, they're in their 70th. So age already has a factor on erectile dysfunction. They're probably diabetic, they are on other medication that are causing erectile dysfunction. So it is not the prostate cancer that is going to cause erectile dysfunction in these men, right? However, once you start treatment, one of the side effects of the treatment for prostate cancer is erectile dysfunction. Prostate cancer does not entirely kill your sex life, right? It also depends on what stage has the disease been found. If we diagnose you at stage 1 and stage 2, we can achieve cure. And that cure also means that even some of the functions, like sexual functions, will be preserved. And I think typically that is why we are here, so that we educate people and then they come to the hospital much earlier so that we don't get these problems like erectile dysfunction. Yes.
Okay, on phone we have Mugodo. Hello.
Hello.
Hello Mugodo, karibu uliza daktari.
Namuuliza daktari. Kwa saa ingine mimi nasikia shida usubuhi kukojoa na umri umeenda zaidi ya miaka 63 na mgongo unauma. Sasa mikojo ukiamka ukianza kukojoa unakuta mikojo inatoka kidogo. Sasa sijui shida hiyo ni nini inasababisha. Na nishaenda kwa daktari akaniandikia dawa zingine nitumie tembe kila siku jioni ninapolala. Nitumie tembe tu, kama vile akaniambia kama vile mtu hutumia aliye na pressure na sukari anaweza tumia dawa amepewa na daktari. Lakini ile hali huwa sengine naona inainuka, alafu inafanya nguvu za kiume pia zinakuwa kidogo dhaifu. Sasa nilipoona hiyo nikaona na mimi pia niulizie ni wapi naweza pata usaidizi.
Mugodo, umesema una umri wa miaka
63.
63. Daktari.
All right. Asante Mugodo. Now, one of the issues that are going to affect prostate, like I've mentioned, the commonest is actually not the prostate cancer. It is prostate enlargement. And that is called benign prostate enlargement. So, wacha tugawanishe hizi dalili za mgondo itutu. Okay? Kuna shida ya mkojo na kuna shida ya mgongo. Okay? So, the prostate might be blocking the urine. Okay? It might be benign. You might be having another problem that is causing blockage of urine, like a urethral stricture, for example. So we need to find out why are we having urinary symptoms in him, okay? It's not equal to prostate cancer. There might be many other reasons why he's having urinary symptoms. So that is number one. Now, the back, yes, one of the symptoms of advanced prostate cancer is low back pain. But cancer is not the only cause of low back pain. So you also need to be assessed for things like arthritis, for example, which will come with age. It can cause that. And the one thing I know this gentleman wants to eliminate is prostate cancer.
Yes.
So go do a PSA test, okay? It's a blood test. You'll be told your figure is 4, 3, 100, 300. I've seen as high as 10,000. So that is the only way to figure out, do you have cancer or not? But these symptoms are not, they can occur in isolation. You have urinary symptoms on one hand, you have low back pain on one hand, but they can also be caused by one thing, like the prostate cancer. So he need to be sorted. Now, the third thing he's mentioned about ni nguvu za kiume, okay? Erectile dysfunction. Again, like I've said, erectile dysfunction is a whole topic on its own and can be caused by many other things, including if you're having back pains, right? So you might be having back pain, you might be having spine problems that are causing erectile dysfunction. Of course, there are medications he's on. Some of the medications that are used to treat even high blood pressure can cause erectile dysfunction, even age. So these things, we need to treat them as one, separate them, then we see, are they related?
Okay.
Yes.
Asante Daktari. We have Felix on the line. Hello, Felix.
Hello, habari ya jioni.
Habari, karibu uliza daktari. Zungumza nasi.
Asante. Niko na swali. Hello.
Yes, hello Felix, tunakusikiza.
Niko na swali, nilikuwa nauliza daktari anisaidie. Niko na testicle zangu ya left side iko na swelling kidogo. Testicle ya left side iko na swelling kidogo. Although swelling ilianza ikiwa kidogo, it's like 2-3 years. Na imeendelea kidogo. So si uchungu, lakini huwa nasikia kama maumivu. Ni kama umeenda gym alafu hiyo following day usikie maumivu, something like that, but just for seconds alafu inatapia. So you kama ni nini hiyo, ama daktari anaweza ni advise aje ili although sijai visit any hospital anywhere ku
Felix, daktari anaomba kujua una miaka mingapi? 41. Asante Felix. Daktari Mwigai, tafadhali.
All right, Felix. So first of all, the other thing I need to tell people, and this is something I see a lot, is testes is not same as prostate. That's number one. Number two is that you cannot touch your prostate, because people come and tell me, daktari, hii prostate yangu inauma. Wapi anakuonyesha? No, you cannot touch your prostate. All right? Now let's go to Felix. It's a testicular problem. Okay, there are many reasons why your testicles can swell, ranging from infection. You might be having an infection. You might be having a swelling there called a cyst, epididymal cyst. You might be having some fluid in it, something called a hydrocele. And you might be having those veins there are probably engorged, something called a varicocele. So Felix, inaweza kuwa ni shida mingi sana zinafanya testicle yako iume na ifure. So the best thing, aende hospitali, he will have physical examination done, so daktari atamwangalia, aguze, aone ni nini, then probably kama kuna haja ya kutumwa scan, atumwe scan, tuangalie ni nini.
Asante. Now, please keep sending in your questions. Tafadhali tupe majina yenu kwenye SMS. And we are taking a very short break. We will be back shortly.
Kwa sasa ninaendelea na matibabu, na kila miezi mitatu huwa ninapata sindano kwenye chini ya tumbo ambayo inatusaidia kupunguza hali ya saratani, ugonjwa wa saratani. Na ni matibabu ya miaka 2. Mnavyoona kila mara mnaona nikifutafuta jasho. Nilielezwa kwamba kuna vile matibabu inavyoendelea, mwili huwa inapokea matibabu na ujumbe wake unaletwa tofauti tofauti. Kama hii ya kwangu inanipa jasho.
As we continue to listen to Willis, I have a question on SMS. He says, I'm 60 years old and I have severe urine problem. I can urinate more than 5 times in a night and the urine just drops. So he says he has done 2 PSA tests and the results have been negative. And what could the problem be? So as we get into this, Daktari, I want us to talk about screening. From what age should we start screening for this prostate, and what tests are these that we do to make a diagnosis?
Okay, good. So now let's start with this gentleman who is talking about waking up at night many times. So urinary symptoms does not equal to you having prostate cancer. There are very many differential diagnoses for the fact that you are waking many times at night, or you're passing urine many times, more frequent, and you're having urgency. When it comes, you cannot hold, you have to run, okay? So this gentleman might be having something called overactive bladder, waking up many times at night. He might be diabetic. It might be prostate enlargement. It might be prostate cancer, many things. But he said his PSA has always been normal, right? So what is normal? That's number one. See, some facilities tell you your prostate PSA is negative. PSA is a value, so we don't have qualitative value of negative or positive. It has to be quantitative. It has to be a number, a value, all right? So the fact that it is negative many times means that your risk of having prostate cancer is low. But PSA is not very cancer specific. We say it is prostate specific because it is produced by the prostate.
By the prostate.
But it is not cancer specific. You actually might have a low PSA, but you still have prostate cancer. It's rare, all right? Granted, most people will always have high PSA, but there are people who have low PSA, but they still have prostate cancer. And I'm sure the viewers are wondering, what is this PSA we are talking about? So the thing about prostate cancer is that you can screen and catch it early. And the way to screen prostate cancer is by doing a blood test. Gentlemen, it's a blood test, all right? I know they fear going to see a urologist because it's a blood test, right? So just go to a hospital and tell them you want a PSA done. It's a blood test that will take anywhere between 15 minutes to 2 hours, depending on the lab. And then you're given a number, a value.
Yes.
So PSA is usually produced by the prostate. However, in certain conditions, it is going to be elevated. For example, in prostate cancer, it can be highly elevated. And it is elevated depending on the severity of the disease, aggression of the disease, the stage. Like I've told you, it can be anywhere. I've diagnosed someone with prostate cancer with a PSA of 3. I've diagnosed someone with prostate cancer with a PSA of 10,000. All right? So it can range from 3 to very far. Okay? So who should get screened for prostate cancer? So every man should get screened for prostate cancer. Now, screening is a very individualized decision that should be discussed between the healthcare provider and the doctor, so that you discuss, do I need to know whether I have prostate cancer or not? What is going to have the effect of this?
I'll hold you for a second. We listen to Kelvin. Kelvin is on the line. Hello, Kelvin.
Okay, that's Daktari.
Yes, Kelvin. Karibu ULIZA Daktari.
Okay. Kuna niko siku nimeenda hospitali, ndugu zangu nimeonesha hapo. Ilikuwa zimefura vitu mbili. Sasa sijajua, na vile nilipimwa nikaambiwa ni ilikuwa last year.
Uliambiwa?
Niliambiwa ni edema.
Edema.
Yeah. Yeah.
Na swali yako ni gani? Kelvin, tunasubiri swali yako.
Sasa shida inatokana na wapi kufura miguu yote mbili?
Okay. So we will get back to Kelvin's question. He's asking about swelling of the legs. I think we had mentioned that in the symptoms. So as we're doing this PSA, what other tests maybe might be required to make a diagnosis? And then what are the treatment options for prostate cancer?
So first of all, PSA is not for every person, all right? Because I've seen young men coming for PSA. So PSA should be started by men over 45 years of age. So if you're 45 years and above, in your next birthday, part of your birthday gift yourself a PSA test, all right, gentlemen? If you have a family history of prostate cancer, your dad, your brother, and you are 40 years, have a PSA done. Now, after that, discuss with your doctor what is the value. Because PSA is not done every year, or it is very individualized. So depending on what value you have, and depending on your risk profile, then we'll tell you, repeat your PSA after 1 year, after 2 years, or even after 4 years, okay? Depending on your risk profile. So the best thing you can do, at 45 years, do a PSA. If your family history, do a PSA at 40. So once we do the PSA and we see that PSA is high, then we figure out what is causing your PSA to be high. If we suspect that you might be having prostate cancer, then we usually will send you to a test called an MRI of the prostate, so that it tells us why is your PSA high? Could it be there's something growing in your prostate? Could it be there's an infection, or probably your prostate is just too big? All right. So once we do the MRI, it will tell us, most of the time it will tell us there's something we are seeing that is growing in your prostate. So the next thing we do something called ultrasound-guided biopsy. Biopsy basically means we put a needle, we target that growth, and then we take a sample of that prostate to the laboratory. Then there's a doctor called a pathologist. We'll look at it and tell us, Daktari, here I can see there is cancer. And he will tell us it is this grade, or this is how aggressive it is this type of cancer.
Okay, now Beatrice is on the line. Thank you. A call from a lady. Beatrice, hello.
Hello.
Karibu uliza daktari, tuzungumza nasi.
Hello.
Yes, Beatrice, we can hear you.
Yes, my name is Susan.
Hello.
I'm calling from Kitui.
Yes.
I wanted to ask the doctor for the medical checkups. For the men.
Yes. Yes.
For the men.
Yes.
How often should they be? And is it possible to make arrangements in the hospitals? So that it is done either annually, and then people are told that there is a screening for the prostate cancer in all the government hospitals and even the private hospitals.
Asante. Okay, asante kwa swali hiyo. I think daktari umeangazia when.
Yeah, I think I've mentioned that.
Yeah, we've mentioned when.
PSA, who should get?
Yes.
45 years. 40 if you have a family history, and discuss with your doctor. It is not an annual thing. It is very personalized. It's very individualized how often your PSA should be done. Yes.
Now from Twitter, we say, hello doctor, I am Ken, 29 years old. I have been experiencing voluntary excretion of semen after urination. Additionally, I urinate frequently at night and have persistent back pain and notice signs of infection every time I urinate. These symptoms have been ongoing since 2022, so more than 2 years now.
This gentleman may be having something called prostatitis. Okay? Like you remember I mentioned, there are many things that affect the prostate. One of them that affects the young men is an infection of the prostate, and it is called prostatitis. That is most likely what that gentleman has.
Is it normal to feel like there's more urine remaining after emptying the bladder? One feels like he wants to urinate after urination.
That's what happens when you're having urinary tract infection, an infection of that urinary system, especially if your prostate might be inflamed, especially for a 29-year-old. Of course, there are many other reasons why he might feel that he's retaining urine. He might be having something called a stricture. There might be the bladder is not contracting enough to push the urine, something called an underactive bladder. So many reasons, but yes.
Now, unataka tuguzie tu treatment. Just a brief 1 minute about what are the treatment options and what are the outcomes. Ukipatikana kuna hii prostate utapona kabisa, or what happens?
Okay. So before we discuss that, maybe I go back to once we do the histology, we get a diagnosis. From there, they will probably send you to a test called a PET scan. I saw Willis
talking about the scan. Yes.
So PET scan will tell us what is your stage.
Yes.
So disease is usually, prostate cancer is managed depending on the stage. Initially, the stage, we divide them into 3, something called localized, that encompasses stage 1 and stage 2. Because stage 1 and stage 2, we can actually achieve cure. Okay, so for that one, you can either do surgery, just go remove the whole prostate.
And out.
Okay, you can go do radiotherapy. You can do something called brachytherapy. Again, there are other things that we look at. It can be locally advanced, meaning it has left the prostate, but it has just gone to the neighbors, all right? There's a neighbor called seminal-vesicle, there's a bladder, the rectum, it's just there, all right? So those gentlemen, like probably Willis, you'll be treated either by surgery, radiotherapy, plus hormonal therapy for about 2 years. And that is what Willis was saying. There's an injection he gets on the lower abdomen every 3 months for the next 2 years. After 2 years, he has finished his treatment. Then from there, is just monitoring his PSA.
Okay.
Then there is metastatic disease. That is means it has gone to the lungs, it has gone to the bones. So that one is treated with a combination therapy, hormonal, chemical, chemotherapy, all those.
Okay. Now, our last caller for the day, Daniel. Hello.
Yes, ni Daniel Ochiko kutoka Ivona Mautuma.
Tupe swali yako.
Langu ni huwa nasikia uchungu upande wa mayai upande wa penis, na ni kitu ambayo imeniuma kwa muda mrefu. Sasa sijajua, nimetibiwa mara kadhaa, nimepewa dawa mingi, lakini inapoa tu kidogo tena inaanza. Inapoa kidogo inaanza. Shida ni nini?
Okay, so Daktari, as you respond to that question, and just tell us in summary what you'd like the men to hear today, kwa sababu hii show leo ilikuwa ya wanaume.
So hii mayai kitu inaweza kuwa inafanya hiyo uchungu. There are many reasons why you can have pain in the testicles. It could be an infection, it could be trauma, it could be that there's probably even something growing. So what I can tell him is that we need to assess it, review it. Yes. So what do I want to tell men, and not just men?
Yes.
Most men that have come to the clinic are usually brought by their daughters and their wives.
Yes.
They don't come alone. So this is for everyone. If you have a man in your family, he's 45 years, please get him screened for prostate cancer. If there's a family history of prostate cancer in your family, get them screened. And it's just a blood test. It's called prostate-specific antigen, PSA.
Thank you so much, Dr. Muigai. It's such a pleasure having you. Asanteni sana kwa kujiunga nasi. Wanaume mmesikia. Please get your screening done. Next week, 8 p.m., we will be back here. Daktari wenyu atakuwa hapa, and we'll keep talking. Thank you so much for joining us.
Wenzangu, tafadhalini, ningelikuwa naenda kufanyiwa check-up kila mwaka ama baada ya miaka miwili, singelifika hapo.